Okay, well, I think we're live now. Good afternoon, colleagues. It's a real privilege to be with you today. My name is Sham Saeed. I'm the Unit Head of Quality of Care at WHO headquarters, and I've had the privilege of working with that for many years on twinning partnerships and institutional health partnerships. I know that you've had an enthralling few hours of conversations and wisdom exchange, and this session really provides us with an opportunity to look backwards for the last few hours, and of course look forwards to the next few days that you will have to continue on this wisdom exchange. So we have four really very sharp colleagues who are going to provide their perspectives in this panel, and each of them will be providing their reflections on what we have heard in the last few hours from a range of colleagues, both in plenary and in the breakout sessions that have taken place. So just to give you a flavor of how we're going to do this, I'm going to turn to each of these four colleagues. We're going to keep this quite informal, first name terms, not too much introduction. Each of the colleagues' bio is on the website, so I'd encourage you to have a look at their backgrounds. They come with a profound level of experience and expertise. First, I'd like to turn to Thin for her reflections, and then I'll turn to Kit, then to Yosef, and then to Anne. Each colleague will provide a 6-minute overview of what they think that they've really heard and they wanted to take away and wanted to share that with you. And then we will then turn to another round based on any of the sharing between the colleagues. So without any further ado, let me turn first to Dr. Thin. What would you like to share with the audience today? Dr. Thin, over to you.
Thank you very much, Sham, for inviting me, and good afternoon, everyone. It is a pleasure to have an opportunity to reflect on this very energetic first day sessions of TED's annual conference. I enjoyed every single sessions of the discussions, and I'm sure everyone felt the same. So if we start off with Honorable TED's Chair Judith opening, who have reminded all of us that the purpose of the conference is to share and to celebrate what we have achieved together as a health partnership community, and to continuously learn from others and from global experts who are convening here today. She also emphasized on the fact that the resilience and the solidarity we have acquired from the health partnership community, despite of multiple challenges that have been imposed upon us, including funding cut and financial challenges, and for all the health workers who are facing challenges beyond COVID-19 in some parts of the world, such as those working in conflict areas. So Judith has rightly covered most of the areas and issues that we are currently facing. And when Dr. Tedros gave his speech, he initially covered the importance of the painful lessons we all have learned from COVID-19. But the key message that we all have to have is the united and compassionate response to hold on to, which I can't agree more. He also highlighted the need for the vaccination coverage for the world population, with the ambition of 40% of the population to be vaccinated by the end of this year and 70% by mid 2020. However, sadly, he admitted that the current condition is far from that ambition, with the high income countries taking control of global vaccine supply versus low income countries. So I'm sure there will be some more discussions about vaccines inequality, how to address this important issue for the global recovery. And the other aspect that he has addressed is the quality of care, which has been threatened even in high-income countries during pandemic. So he has suggested and called for the investment, more investment in primary healthcare and promoting health, which I think is a very relevant and important issue to face to come out of the pandemic recovery and also uh, fit, prepare stronger for another challenges that has yet to come in the future. Then we heard three brilliant speakers from Professor Chris Whitty, Louise, and the Chris Carter panel discussions. So from Professor Chris Whitty, he has clearly described how health partnership creates platform for health worker development at personal and academic level. At a personal level, the partnership work allows to acquire specific technical skills, disease epidemiology, how to care in limited resource setting, and how the research platforms can be facilitated. And also, we have to remember the improvement of technology, which is allowing uh, the strengthening of the health partnership capacity and the strength in this pandemic age. And from Louise, we have heard that the pandemic has brought health partnership community and unity and has led us to adaptation, how we respond and restructure our programs and also use innovative technology to keep connected to health partners around the world, and how this pandemic and the inability for the physical presence of the um, our presence in the counterpart countries have boosted the increased ownership and engagement of the local community and the local organizations. So, from these panel discussions, the main theme is that the health partnership plays a central part in the advancement of the personal level as well as the organization to organization relationship and um, the role of health workers and their united response in these health partnerships. Then I went on to joining the health system resilience breakout sessions offered chaired by Jonty and three brilliant speakers from Professor Aja and Professor Weizua and Dr. Sansan U. So the key uh, take home from Professor Aja, who have described the health system resilience in internally displaced population in northern Nigeria and Syria. Um, he has shown and shared us the very rich system approach on the cause analysis to the problems. And the three take-home message that I got from Professor Aja to the health system resilience is number one is absorption, how the absorption and the how absorption can help, such as absorption of the staff and supply of the medicine, will help planning to respond to the crisis and the shock. And the second is adaptation in terms of restructuring how the staff structure and the medical supply. But the importance in this adaptation is to empower people and to give license to allow this adaptation to happen. And then lastly, sometimes adaptation might not be enough to address the challenges and the shock, and the whole transformation and redistribution of the resources of the model may be required to, res- to respond to the shock and the challenge. And the second speaker, Professor Weiser, shared his experience, the Uganda health system resilience for maternal and child health services, and how to overcome the underusage of the medical services during the lockdown in Uganda. And his key sharing point is the political engagement and commitment to address and to coordinate the responses that was attempting to offer. And lastly, I heard from my colleague and friend, Dr. Sansang Wu, who has described the experience of COVID-19 response before the coup and after the coup. We all knew that Myanmar is a country with very limited health resources, and before the coup, Dr. Sansang Wu shared with us that the COVID-19 response was handled in such a way that very low number of mortality was seen compared to other countries in Asia, and Myanmar was the first country to be vaccinated around in March 2021. In contrast to this, the COVID-19 third wave hit in middle of June, which we sadly saw incredible number of deaths from it, and also mainly because of the shortage of the oxygen and other essential medicines for COVID-19 response. So her key point here was the political commitment and the political leadership, which has made this difference, which I totally agree, and I'm sure we will be hearing similar experiences and examples as the conference goes. So, all
Thank you.
in sorry, am I going over my 6 minutes?
Yeah, I've been waving for a little bit, but that's okay. Do you want to just wrap up?
Yes, all in all, despite of all the challenges as we have seen, globally from the pandemic, I have very a strong confidence in the health partnership and the health workers after surviving this pandemic, that we will use all the lessons learned from this pandemic to have more solutions and answers to get out of this pandemic and offer more to the world. Thank you.
Thank you, Sin. Really, very nicely laid out, and you've actually summarized all of the proceedings very beautifully. So, if I can turn immediately to Kit for her thoughts on how she viewed the proceedings of this morning. Kit.
Thank you, Shams, and thank you, Sin, for that. And I'm determined not to repeat what you've said, but I do just want to go back to Dr. Tedros's opening comment that a common threat needs a united and compassionate response, because I feel that that's really at the core of what we've heard today, is about the united response that the health partnership community has shown, and lots of different examples of that. And compassion, the word, hasn't been said in many other sessions, but I think it's come in through the stories that we've heard and the things people have spoken about, and is of course at the core of the quality healthcare that all healthcare workers strive to provide. In thinking through the sessions as a whole, I've written down 3 words, and they are challenges, solidarity, and flexibility, because I think that they're things that have come up consistently through the different talks. In terms of challenges, of course, the main one, which is still at the forefront of everyone's minds, has affected so much, is COVID, and we've spoken about the effect of that on health systems, on healthcare workers, and the challenges that people are still facing, and of course in terms of vaccine equity. Although it was heartening to hear Chris Whitty mention the launch of the approval of the first malaria vaccine, which brings us into thinking about those other and wider challenges, which Chris Whitty also mentioned in terms of non-communicable diseases, which THET has been working on alongside the health partnership community for many years. And of course, remembering that COVID isn't over. And we all know this, but the challenges of COVID have not finished and will resonate for a long time. And aside from the ongoing pandemic, we have the knock-on effects on care, which we will need to continue supporting each other with over the years to come. Which brings me to solidarity, which came out, I think, particularly in Louise and Chris Carter's talks. And Louise talked about ways in which health partnerships have worked together, and thinking of another challenge beyond COVID, to the crisis in Myanmar, which Sin has spoken about. and how people have come together to support each other and to support healthcare workers across the world, so far away with supporting resources, and that fantastic figure of 5,000 live users of an online platform with supporting resources for healthcare workers in Myanmar struggling to amidst the political turmoil. So solidarity very much on display there, and Chris Carter is extremely powerful. His group has been working with and in Zambia with colleagues to help train them and supporting each other through the pandemic. And the circular nature of his thought from the first healthcare worker he spoke to there many years ago, Esther, wanting training for nurses, and how that has gradually started to come about through the work they're doing, and that there are more training colleges in Zambia for nurses now, although Esther sadly does not live to see that because of issues with the care provided around her own delivery of children. So moving on to the well-being, and within that everyone has displayed the incredible flexibility which was mentioned throughout. And in the well-being panel, high change environment was identified as one of the risks to well-being. But also, in order to remain flexible, well-being is key. So clearly, focus on the well-being of healthcare workers is incredibly important. And the key quote I think I took from that session was, to do well, we need to be well. And again, that comes down to collaboration. So I think that the stream today has been about resilience, and there's a risk that we think of resilience as an individual attribute, and that if an individual isn't resilient, then there's some kind of failing. But really, we're talking about systems and organisations and the leadership and the culture that they depend on, and that was discussed very much in the well-being session. Some examples from other professions as well as healthcare and perspectives from across the globe. So very powerful testimony from work in Uganda. So I think I would wrap up my comments by saying that amidst all the challenges, we are, as a health partnership community and healthcare workers in particular, showing flexibility, and it's that flexibility and the solidarity and the connections amongst us that will get us through this, and that will help to continue build the quality of care and to recover from the pandemic afterwards, to get back into a position where that's possible. And I'm sure we'll hear more about all of those things in the next 2 days to come.
Excellent, Kit, excellent, and really some thought-provoking pieces that you've provided there. Just keeping the pace, let's move on to Yusuf. Yusuf, over to you. Yusuf, you are on mute.
Thank you, Sham. I also found all the presentations very enjoyable and enlightening. I'll try my best to skip what my colleagues have already covered. In the plenary, I will try to focus on Louis' presentation on health system strengthening and resilience. We were able to see in a lucid presentation how health partnership have grown over the years through innovation, responsiveness, sustainability, and accountability, and so on, to achieve two very important things, which has been demonstrated even in the various presentations, the breakout as well. That is solidarity among health workers in UK and low middle income countries in Africa and Asia, as well as contributing to the health resilience, health system strengthening as well. We were walked through opportunities and challenges of COVID for all this to manifest, like, increased solidarity, the adaptation to new ways of working, innovation, like, local production of gel. These were all very important frugal technologies that fit the needs of low middle income countries. In Myanmar also, clearly the solidarity between UK health workers and Myanmar health workers was seen, and new alliances were built, new networks also came into it. These were very important fruits that were born by these many years of partnership, which has been shown. And this COVID has been a blessing under disguise to make these things manifest. Going to the breakout rooms, I attended the health worker well-being session, where very good speakers like Imawadi, John Smithson, Sarah Makam, and Harriet Nainga from Uganda gave us a very good highlight of their hand-on experiences. Ima shared with us very important points, like, from her very long personal experiences, that the most that resonated with her conversation with colleagues was very important things were relationship and networking, personal and patient safety, and the wish of health workers to be part of the transformation, being part of new way of working and new areas of working. These were what resonated most from her general conversations. Joanne, very good points on well-being and personal. Well-being is a very personal and subjective thing, and it cannot be tailored to all. And we have to, and it is broader than just mental health, because it encompasses not only mental health, but also physical, as well as the social dimensions. Work is the most important factor that affects our well-being, positively or negatively. If work is satisfactory, then it increases our personal efficacy, gives us purpose, and gives us social connection. While if it's not managed well, then it's a reason for stress, burnout, and eventually mental health. So that was very important issues that she has raised. Sarah, through the calm strategy, that is, she demonstrated how culture can be changed to be favorable for mental health and general well-being. It was a very, very smart strategy, the calm strategy. And need assessment is made, a planning workshop is done, and then implementation and evaluation, the usual project cycle, but a very coming, emanating from personal experience of the impact of work on her health. That was also a very good sharing of experience. So the outcome, there was both personal outcomes of those staff, as well as for the organization as well, to plan strategy, and also a new strategy based on this experience was very good to hear. Finally, Harriet, working in Uganda, a midwife, a leader on the grassroots, bridging the gap between community, as she said, and the midwives, and helping the sexual problems, reproductive health problems of teenage girls. She has shared with us how the power of partnership, the power of networking, how she has been empowered to bridge that gap, and how it is very important for partnership to focus on this kind of support. Thank you, Shah.
Thank you, Yusuf. Very clear and focused. A lot of food for thought just keeping the momentum. Anne, over to you to wrap us up. Communication colleagues, is there any way of unmuting Anne centrally?
No, unfortunately not, Dr. Shams.
No? Okay, and well, we will, let's, do you want to give it one more try with an unmute?
Anne, it is possible to mute and unmute on the tab. If you navigate up to the tab, is it possible you've pressed mute on the tab? Maybe not.
Okay, well, these things happen, and we'll take the pressure off you. You can just see if you can find the button if you can, and we'll come to you as soon as you're able to. What I'd like to do now is just to really go back to the three colleagues and ask them what they would really like us, the participants within the conference, to focus in on for the next few days. Just before that, just a couple of thoughts from myself. The word vaccines is inevitable in the world that we live today, but let's just remind ourselves that vaccines don't deliver themselves, and we need services, and we need quality services to be able to be a vehicle for that vaccine delivery, which is critical and required, and equity is at the heart of that. The solidarity piece that everyone has highlighted, unsurprisingly, within the partnership community. We're all champions for solidarity within the partnership community. And somehow there are often times when you or anybody within the partnership community can be in a bit of a minority. How do we equip ourselves to hold our ground in a room full of those that are not quite there with the same spirit that is clearly prevalent within any THET conference? So that's another point to ask ourselves, is how do we make the case for solidarity when the pressures, and the real pressures, are high?
Dr. Shams,
Yes.
I've been able to rejoin.
Wonderful, wonderful. I'll come to you just in 1 minute, Anne.
Okay, thank you. Thank you.
And with that, also the third point is when we talk about resilience, and this came out in the report backs from each of the three of you, let's remind ourselves that it's not just healthcare, not just health services, but total development. So this is where perhaps the Sustainable Development Goals come in a big way. And we can't afford to ignore the Sustainable Development Goals as we are in the midst of the pandemic. So resilience has manifestations in all sectors, and this is where our attention might lie. Again, the partnership community can be a champion for this, and many of the points that have been made really speak to this in a specific way. So let's come to Anne. Anne, coming to you and thinking through what you have taken away from the last few hours. Anne.
Well, thank you very much, Shams, and apologies for the crisis over muting and unmuting. I think because we've lost some time, I think I'm going to, with your permission, Shams, I'm going to just jump ahead to final points.
Please.
Thank you. Thank you.
By all means.
So I think overall, the two points that I would like to flag up, thinking ahead to the conference as a whole and taking a macro systems approach, because that is my own field. While we salute, absolutely we salute the resilience of our brilliant colleagues and partners in the face of the political instability, climate change, and COVID that they face on an ongoing basis. We have to say that resilience is not enough. I think I'm picking up on something that you were getting at here, Shyam. For progress in health services and delivery, there's also got to be some fundamental system changes which provide this foundation within which resilience can flourish. What does that mean? Internationally, it means providing sustained financial support for LMIC, and nationally, it means budget resolutions around providing resources within country for the employment of needed health workers, may be trained but not deployed without budget support. So we need a health financing perspective to engaging with the wider environment within which resilience can be seen and taken forward. And then secondly, again, picking up on some of the macro issues here, looking ahead to forthcoming sessions on a global perspective, the global perspective is very, very welcome. Global solidarity is the only ethical approach in the times in which we live, and indeed it's an ethical imperative. And fundamentally, a global approach is also the most pragmatic and effective approach. And as Dr. Tedros said, unless all are safe, none are safe. So those are my two final points. Thank you.
Wonderful, Anne. Thank you for such a succinct point. Just turning to each of the colleagues for their hopes for the next few days, and also how that will affect the partnership community for the next few months. So Thin, then to Yusuf, then to Kit, and then finally Yusuf. Thin, please.
Thank you, Shyam. So the 3 points you have touched upon: vaccines, solidarity, and resilience. So in not only just from the global perspective, because I'm based in Myanmar, you probably know that the Myanmar's vaccination rate is very low, one of the lowest in the region, 3% of the population, and all the challenges that we are now facing to get access to the vaccines from the COVAX facility and other sources. So from that perspective, I would like to hear more in the next few days how vaccines inequality can be addressed by the international partners and our partnership. And in terms of the solidarity and the resilience, we are the colleagues from Myanmar and the healthcare workers are very much relying on the the solidarity and the strength that are shown by our colleagues and the health partnerships in the previous 7 months after the tremendous challenge that has been faced upon us. So we can't thank all of our health partnership friends and colleagues enough for standing with us firm and strong. And we have every hope and belief that we will overcome all the current challenges. It may take long, but I have every confidence that we will overcome and will be able to work together in physical presence. And I would like to hear how the health partnership community will stand and build more resilience in the next few days discussions. Thank you, Shyam.
Thank you, Thin. These are really emotive words, and we salute you for everything that you're doing, Thin. Kit, turning to you and then coming to Yusuf.
So I think what I would like to see, and what I'm sure we will see from the rest of the conference, is examples of and ideas about what we can do on all these themes. On rising, so there are challenges, we know what the challenges are, but on the background of that, what can we still do? What can we take forwards? And that might be very small things in some ways, and it might be very, very big and influential things from other people. So it's what we can do as individuals, as partnerships, as organisations, to rise to these challenges and to keep doing that. And I think I see a question about are we listening to the voices of the less resourced and vulnerable? It's too big a question, isn't it, for the last 2 minutes? But I think that is very variable. And again, I think doing what we can to make sure that's happening is really important. So I'd like to think about those things. What can we do? And to hear people's ideas, participants' ideas through the rest of the conference.
Very clear, Kit. Thank you for that. And Youssef, turning to you to wrap us up. Youssef, I think you're still on mute.
Excuse me. Thank you, Sham. I have high hopes and already very far. The vaccine equity is not only an issue of just a high moral stake, but it's also a pragmatic view of survival on the human rights. Unless all of us are safe, unless all of us are covered, we are not all safe. So I think the solidarity plays an important role. It is, a manifestation of willingness to carry costs to assist others, and so to share the sameness, to share problems with colleagues the other side of the world. So I think if we utilize this solidarity already built between the north and the south and the east, I think we can find ways of advocating more for this equity, and also eventually in its implementation and in the access to vaccination to as much as possible of our population in the world. That's my hope. I am optimistic.
Thank you, Youssef. Thin, Kit, Youssef, and Anne, thank you for really synthesizing the proceedings, because often when we go through multiple days, you can almost, there's so much content that it's very hard to distill, synthesize for action. And you've done an incredible job in bringing it all together for us, for looking forward for the next few days. Before handing it over to Jonty for his remarks, if I may just highlight one thing, this point that Youssef has just made, the words human race. We don't hear that often enough, I suspect. And it's really interesting that we, in the partnership community, can focus in on very small actions with meaning. And it goes all the way to solidarity within the human race. And that's something that I think the partnership community should be really proud of. I'm sure that the day-to-day has given us a lot of food for thought, but we've got 3 further days to continue this exploration. And I know that we're all looking forward to doing that exploration together. So thank you again, Finn, Kit, Youssef, and Anne. No formal introductions for Jonty. I think he's well known to many of you, and his bio is on the web page. So Jonty, over to you.
Thank you, Shams. What a lovely thought to finish on there. That's very, very moving. Okay, well, it falls to me to tell you what you're going to be tuning in for in the days ahead. So you've had the reflections. This is what to look forward to in the days ahead. So I'm going to give you my personal highlights of the agenda coming up in the next 3 days of the conference. We've had a great morning already, and thanks to all the speakers and to the conference staff that have made it look this easy. So tomorrow we continue the resilience theme with a session on insights from an unequal world, which is chaired by the fantastic Victoria MacDonald, Head of Health and Social Care at Channel 4, my favourite healthcare journalist. And there are some great speakers for that session, reflecting on some of the themes that have been picked up on there in terms of solidarity and some of the shared experience of our and not shared experience that we've had through the COVID pandemic. We have Manar Gas, Head of Hospitals at Ministry of Health in Somaliland, and C. Thura, the Executive Director of Community Partners International, an NGO that's heavily involved in delivering programs in Bangladesh and Burma. But honestly, I would turn up to a session where paint was drying if Victoria McDonald was chairing it. So I heartily recommend that session. That's at 9 a.m. tomorrow. It's followed by another cracker at 12:30, the presentation of THET's latest policy work, which is on diaspora. It's called Experts in Our Midst. We've talked a little bit today about how some of the things that maybe health systems took for granted ended up being their biggest strengths through crisis. And I think diaspora is one of the major areas in which we have we've found real untapped strength. So we're going to be talking a lot about diaspora there. And then the day will finish with a plenary from Jane Hutt, the Minister for Social Justice, great job title, at the Welsh Government. Wales, of course, has always punched above its weight when it comes to health partnerships. They are rightly proud, and Jane is coming fresh off of a review that is underway at the moment on Wales's place in the global health system and the role of health partnerships. So there'll be a lot to share there. We have the weekend, and then we come back for Monday, where the theme is solidarity, starting with a keynote from the wonderful Elizabeth Ero, Chief Nursing Officer at WHO, as well as Dr. Tadesse, the Minister of Health from Ethiopia. That's followed by a panel session focusing on global Britain and the role of health partnerships in the new political world that we find ourselves in the UK. And then another panel session by my dear friend, Sir David Nicholson, the former Chief Executive of the NHS, who has been spending a lot of his time working globally since leaving that position, as well as in the West Midlands. And he is going to be chairing a new initiative of THET, looking at the mental health of the health workforce during the pandemic. You saw in the panel discussion there reflections on the fact that we've learned a lot about individual resilience, for better or worse, in this pandemic, not just system resilience. So there's going to be a new review that is David is chairing, commissioned by THET, to look at that issue of the mental health of the health workforce. And then on Tuesday, the final day, we have a session on the UK's latest refresh of its international development strategy and global health approach, and are going to be thinking about the role that health partnerships has to play within that. How do we need to reposition ourselves and make sure we're serving that and making the most of the opportunities. And then the whole conference is being summed up at the end by a double bill of THET's outgoing chair, Judith Ellis, and the chief executive, Ben Sims, to see us through to the end. So an absolutely fantastic program. More of the great things that you've heard today, and we really do hope that you will tune in for all of those sessions. And at the end of today, fill out your review form, because it really helps us to improve this session. This is new approaches in the new world, so it would be great to have your thoughts on how the day has gone and how we can improve it for future years. That's it, I think. Thank you all for coming. Thank you all for engaging and listening and being so effusive in your comments and your questions. We will see you again at 9 a.m. tomorrow. Enjoy the rest of your day.